Good afternoon. I'm always a little leery when I get introduced and I think, okay, all I've done is my work. So I appreciate the introduction. And I'm delighted to be here, especially with Michael, to talk about a project that actually took the organization a considerable amount of time to accomplish. Spectrum Health Services started in 1967 by a group of residents in North Philadelphia, and it actually started out as a center for reproductive health care. And my predecessor, who was a 30-year director and nurse, as they were providing services throughout the city, recognized that a lot of the residents that they were serving were not in routine primary health care. And so in 1983, Spectrum Health Services applied for a 330 grant, and I don't know how many of you know Community Health Center, but there are 1,200 community health center organizations across the country. We are funded through an authorization by the federal government, which was established in 1967, and it is to provide and establish community health centers in low-income areas. So we are built in designated areas that are underserved. So our mission is to provide health care to anyone, regardless of their ability to pay for that care. So that is something that all health centers do, and there are approximately 1,200 health center organizations with 10,000 sites across the country and in Puerto Rico and in the Virgin Islands. So is that my, thank you. Oh, thanks. Okay. So Spectrum Health Services became the full service as I said, in 1983 and moved, did I do this wrong? Okay, did our mission. And I wish we had had an opportunity to put our before building in. We were in 10,000 square feet in West Philadelphia. And if any of you know West Philadelphia, we're a University of Pennsylvania is in the 3,400 block. We're in the 5,600 block. So we're not that far from the university, but in what they call Haddington Plaza. It was a little storefront that was renovated when the center received the funding, federal funding in '83, and quickly outgrew that space and realized that it went from 4,000 square feet to the 10,000 square feet we had when we left. But it took almost 20 years to make that move. Spectrum, our patient base, we serve a little under 10,000 users. We had 36,000 encounters. As you can see, demographically, we still serve a principally or a high number of our patients are female. We are a middle-aged, young provider of care, but in a lot of ways, we were not physically, but we had physical barriers to being able to serve a senior population. So that with our new space, we're much more senior accessible. So that's one of our target populations to grow. And most of our patients are from the immediate Philadelphia areas. Our patient demographic, we are 95% African American, Black, and you can see the rest of our populations there. So we serve a predominantly Black community. Our payer mix, as a federally qualified health center that provides services to anyone regardless of their ability to pay, that keeps us kind of on the edge. Because a lot of the folks that we serve are not able to pay the cost of our care. So a lot of health centers especially on the East Coast, I'm not sure about other areas, our bread and butter is Medicaid. And so we are like a lot of centers where it's 50%, we are 61% Medicaid base. But we have a decent payer mix of 14%. And as you, again, can see there, our Medicare is low. But we serve a 19% uninsured, and sometimes that can go up to about 25%. So that has actually been impacted, though, with the implementation of Obamacare. And so a lot of our patients have been able to receive insurance. However, Pennsylvania remains one of those states that has not been willing to implement expanded Medicaid. So again, we still struggle with increasing access to insurance for our residents. I came from Boston, Massachusetts in 2004 after my predecessor, who had been there 30 years, died suddenly in August of 2003. And I came in January of 2004 with the hope of being able to build this center. So sometimes you do get what you try to achieve. So we're very proud that we were able to do that. Our center opened a year ago in 2013, so we went from our 10,000 square feet to 36,000 square feet. We went from 14 exam rooms to 37 exam rooms. So it was significant growth in our physical plant, but it really allows us to provide medical care in the way that we think is important for our residents. So we're very proud of that. Our staff are very happy about that. It's a really beautiful building. Our patients walk in and they are like, wow. And it really had to have a wow factor because we're down the street from Penn. We're down the street from CHOP. You know, we needed to be competitive in how we looked. So we were very proud that we were able to achieve that. We also were able to become certified with the National Committee on Quality Assurance. We knew, and we started that process before we moved. We knew we couldn't get our building JACO accredited, so we said, okay, but we can do something that really speaks to the quality of care. So we started NCQA and were able to achieve a level 2. So we were very proud of that. So we went into our new space with that, and now we're going to level 3. And you know, it just spurred our energy around showing that we could provide quality care, and now we had the space in which to do that. We implemented our practice management system in 2009. We were one of the few health centers that went fully electronic, even though we're not as big as some of our folks, but we really understood that if we were going to be able to look at the quality of what we were doing and really look at outcomes, you can't do that today without an electronic system. So again, it was another thing that we felt was important for us to invest in. So we're very happy with that. We are not unfortunately, but we are currently looking at a new system because when we first went to our system, it was a new system on the market, and frankly, we didn't understand exactly what we needed for a system to do. So we are now going to be going to a new system that allows us to incorporate all the things that now health centers and hospitals have to do around meaningful use and just looking at all of those indices that are going to be reimbursed through insurance if you're able to achieve them. So you have to really demonstrate, not to mention that we want to know, are we in fact achieving what we're trying to do in terms of our patient care? As I said, we are funded through the Bureau of Primary Health Care Services, so that is a Department of Health and Human Service organization under HRSA. And if I'm throwing out acronyms, please stop me, because that's just, that's a language we speak, but I'm sure many of you are familiar with that. Health centers are funded in 5-year cycles. Actually, that is changing now. We will be funded under 3-year cycles. And we report every year. We do an update on our work yearly. And we look to see not only in terms of service delivery, but we look at those operational things as it relates to wait time. We do patient satisfaction surveys. We went to a open access scheduling system, which allowed 24 to 48-hour access to care. And so, again, we try to do things that really increase and improve access. We are a full-service health center, including adult health, pediatric care, prenatal, and GYN. Our new building allowed us to do something that we hadn't been able to do in the history of Spectrum, and that's have a dental program. So we were able to build an 8-operatory dental suite in our new building, which we are, it was a year old in July. Much needed service. Many of you who are in healthcare know that if your mouth isn't healthy, then the rest of you, it's a struggle. So we saw a lot of patients for whom oral health was a significant need. We have 2 sites, one in West Philadelphia, which is where our new site is, and North Philadelphia, which is where the original site was. It's not in the original site location, but we maintain a presence in North Philadelphia. The other requirement for being a 330 health center is that a majority of our members of our board have to be patients and/or residents of the community we serve. And so our board is a 9-member board, and the majority are patients. And that provides us, that kind of keeps us grounded. That helps us really understand the impact of what we're doing because they are patients there. Our new center, each year we will grow, so we are projecting 5,200 visits this year. We'll have almost 80 FTEs, and we've got a $9 million budget. We thought it would be interesting, although I'm not going to go through this slide, but it was really a challenge to find and organize and get $15 million to build this building in today's economy. But we've had multiple funders who were willing to invest in our building. So they're the group there. And Capital Link actually is the group. Capital Link, I don't know if any of you have worked with them, but they are the group actually that introduced me to Spectrum because they were working with Spectrum while I was in Boston, and Capital Link is a Boston-based organization. So their president said to me after their director died, "I have a place that you should go." And I remember saying, "Why?" But when I got to our center in Philly, I realized, okay, no, this is not how you deliver health care. This is not. Folks are entitled to something that really mirrors a quality facility for quality care. So I chose to come to Philadelphia and try to. I said I can't guarantee that I can build a center, but I can certainly take the shower curtains off of the pediatric area that they were using for doors. So that was what spurred me to go to Philadelphia. And we were able to engage a group of funders to support our center. So we were very happy about that. And if there are any questions, I mean, I don't want to take the time. It is a very complex transaction. It includes new market tax credits. It includes federal dollars from brownfield money, HUD 108 monies, and leverage loans. So it was in the state also provided us with a $2 million grant. The other thing that was of interest is because of the complexity of dollars and the nature of the dollars, we had to form a separate corporation So SHS Community Health is the owner of our health center. Spectrum Health Services is the operator, so we operate, but we had to sit it in a different conduit for funding purposes. So we have a separate board for that to manage the center. So I've actually, I think, spoke about a lot of this, so I will move forward. When we purchased, I think what I left out there is that we were able to purchase a site in 2007, which was a doctor's office practice, which was 4 blocks from our old site. And it was went on the auction block. So we were able to purchase it for half of its value at a sheriff's auction. So that got us started. And once we did that, we began to develop our design. From the very beginning, we felt it was important for our building to be built with the goal of becoming more energy efficient over time. It just really didn't make sense to be building a building that wasn't going to be able to capture savings over time, minimize cost. And we were a health facility, so we felt, well, we should have a building that we could speak to as being as healthy as we could make it. So we, at the beginning, looked at, okay, what is LEED? We didn't know what it was exactly, but our architect said, well, okay, this is what it is. And then we would find folks, and Michael will talk to you about the partnering that we did as we rolled out the design. But we thought long and hard because we knew this was going to be something that might add to the cost of the building. Certainly, it added a little time and just being able to really understand, what we could do and what we felt we couldn't do. So we looked at different aspects of sustainability. We looked at a geothermal and wind systems. We looked at solar panels. We were even thinking we would put a green roof on our building. And after we looked at those more closely, they were not affordable for us. They just didn't give us the return in a timely way, and they did add significant costs. And unfortunately, there was no one who funds. We couldn't write a grant to get additional money, so that would have had to have gone into the cost of building the building. So we said, okay, there must be other things that we can do that allow us to have an energy efficient building, try to, if not reduce costs, contain cost, and really incorporate a healthy environment with discussion with healthy medical practices. So I'm going to have Michael come and talk about a lot we learned just through this partnership and building the center. So, Michael.
Thanks, Phyllis. Good afternoon. So I think what's really interesting from my perspective working on this project is that we do a lot of sustainability consulting in the healthcare sector, but a lot of it is focused in bigger, I'm going to say, healthcare systems and institutions that have multiple campuses, multiple sites. They typically have a pretty large acute care hospital affiliated with them. But what I think is unique about Spectrum is that it's a community-based health clinic. And that's where I think we should start to see, I'd like to see more sustainability kind of go into these local base where people are getting their care who aren't going to a University of Pennsylvania health system. They're not going to Temple. They're in the communities, and integrating sustainability into these is key. So as Phyllis mentioned, what was great about working with Spectrum was the push for sustainability overall in the whole building was really directed from the executive level and the board throughout the process, from the planning stages all the way through. We had some iterations of design and through construction with the contractor. And I think when you have that top level support for sustainability and energy efficiency, it definitely, you really see it through because you have the push from the C-suite level throughout the whole process and the board. So Phyllis mentioned a few things that we explored, and I'm going to take you into some of the details of actually what was implemented and what that meant for Spectrum in terms of a healthier center and a more energy efficient center. So People, Planet, Profit is really what we focus on when we look at sustainability in our work. And we try to, I think a lot of this, I'll bring these kind of all up, but I think one of the main things that Spectrum was interested in is tying in the people that they're serving in this facility with bringing the cost of the services down in terms of operational costs so that they can funnel that that savings into improved patient care, which Phyllis said. And she gave you the mix. The reason why we kind of set that up for you at the beginning was so you could see it's not you know, suburban where everyone has insurance and there's money flowing through. It's a different scenario. So we really wanted to be cognizant of that when we were looking at operating costs and expenses. So the first thing I think what's unique, and Phyllis mentioned this a little bit, but we want to show you a picture is, so this is the actual site right here, and this was the building that they bought. So this was what it looked like in 2009, and it was a brownfield site because that building that was existing was full of asbestos. So there was a huge remediation effort that went into the site, a phase 1, phase 2 environmental site assessment to make sure the site was clean. And this also helped with some of the funding. So there was a $2 million federal grant to get rid of that building and really improve the site. So some of the things, basically, I think that we really, from a community perspective, was this, you can't really see from that map, but this is kind of I'd say a fairly highly prominent corner in the community. This intersection here is a main conduit down to the elevated train system in Philadelphia that is a hub, kind of a commercial corridor. So this corner here was really a mecca, and I think from the social perspective, Spectrum really wanted to come in and improve the community by not only the brownfield site issue, kind of remediating that, but also making, if you know West Philadelphia at all, some areas are challenging neighborhoods, to say the least. So really making it an improvement in the community and then having that be a catalyst for change throughout the rest of the area around the health center. So that was, but I think that site was one of the first decisions toward sustainability and tying in the community with what they were doing. So if anybody's familiar with the Philadelphia Water Department, we actually have some of the most stringent and progressive stormwater management protocols that were implemented in mid-2000s in the country and are used as a model around the U.S. So if you're building a new building or doing major renovations, you actually have to hold and contain all of your stormwater or any precipitation on your site for a major storm event for 24 hours, and then you can slowly release it. So you can't put everything basically into the sewer directly from your roof and from your site. So this is a rendering of the building. And what you can see here is all of our stormwater from the roof, and there's a very small parking lot, which is another issue we're dealing with, Phyllis is dealing with now. It actually goes behind the building here into pipes, and then it actually slowly goes down through perforated pipes and gets released through this vegetated swale. This is a picture right after it was installed, so it's definitely grown a bit in terms of the plantings, but there's no stormwater that's going into the sewer immediately. So that was a big point we wanted to make in terms of just being responsible with our site and kind of continuing that through to all of our stormwater management. The experience of the patient that's coming to this site. So the majority of people that are using this center for healthcare are taking public transit, they're walking. So there's the bus, there's the elevated, there's walking, there's biking, and then about 10% when we surveyed the staff also use alternative means of transportation to get to the building. So to kind of promote that, what we did is the building is located within 400 plus bus and subway trips, which are on a 24-hour basis. So there's a lot of access to this site, very easy to get to. We also have bike racks installed and showers in the building, so patients and staff can use those. Staff can use the showers to get there if they want to ride their bike to work, back and forth, and I think some of the physicians do. The health inside the building was really important from the perspective of indoor air quality. So all of the adhesives, the sealants, the paints, the coatings, and a lot of those, for those of you who are in the healthcare kind of sector and construction and design know, in the healthcare sector there's a lot of, in a building, more casework and more kind of pieces that go into a healthcare center than a typical like commercial office building. So there was a lot of care spent with the design team and making sure that everything we put in was as low a VOC as we possibly could find. Below the LEED standards, we were well below that because we really wanted to make sure that the building was, we weren't off-gassing after it was improved, after they moved in. We also even looked through all the furniture and the medical furnishings that went into the space, so cubicle curtains, the chairs, the exam tables, everything like that was examined. This was done sort of, Green Guide for Healthcare was out. LEED for Healthcare was, I don't think it was quite out when we embarked on this process in 08, 09. But we did implement some of the Green Guide strategies from the design side before it kind of morphed with LEED for Healthcare into the design of the space. We also made sure that all of the filtration media were as high as we could get with our HVAC system. So MERV 13 filters, which is not quite an acute care hospital, but it's fairly close in terms of reducing the contaminants that come into the space. And we were very careful during construction. All the ductwork was wrapped. We did a complete building flush out before they moved in to the space. So that was some of the pieces on the inside of the building from an environmental standpoint that we focused on. In the construction of the building, we almost got to 95% for the construction waste, which was great. 18% are from recycled content, and then we used FSC certified wood, which carried a premium, but that was important from an environmental stewardship standpoint to Spectrum Health to make that commitment. But I think what's interesting is, in terms of waste, the building has actually implemented a program that's fairly unique in at least our work. It recycles, obviously, and trash removal, but then they also do organics collection. So that's becoming more and more popular, but so we have a service. Spectrum has engaged someone to come in and collect food waste, scrap, so that we're really diverting the waste that's going into landfills, essentially, because when you have 84 FTEs all eating lunch or breakfast, and they're open. One thing we didn't cover was the hours. It's not a 9 to 5 facility. I mean, it's open into the evenings. I think it's even open Saturdays too. So when you think about the hours, it's not 40 hours. It's much longer duration. So you have more people who are eating lunch there, eating dinner there, eating breakfast there. I mean, and people coming in with snacks, who are patients. So that was a big thing because we wanted to carry on the message of reducing our waste to the patients and the staff population. So what we found through that process was it actually reduced the cost of the hauling because the organics is actually some of the heaviest waste that you have in a facility because of the food waste is typically heavy. And then they're recycling everything else that you would typically recycle. But it's a great story. Because that's hard to do in healthcare facilities. From a water perspective, so we implemented, we have about a 26% reduction in potable water. We're tracking all of the water use in Energy Star Portfolio Manager of Spectrum right now. And then we did not choose to implement any irrigation on the site. So the plantings that you saw are all drought tolerant and native to the Philadelphia area. I think the most unique thing is Phyllis mentioned, we did explore, we had a lot of goals at the beginning from an energy standpoint, from geothermal, photovoltaics on the roof, a vegetated roof system on this back side of the building, which it was actually, it can accommodate because you do see it from this third floor. And then small wind turbines. The issue was with the funding, we just couldn't get the return investment, unfortunately, to work. So we did as much as we could in terms of efficiency and estimated about a 10% reduction above a baseline code compliant building and about a $5,500 a year savings just in energy, not in water. So that's our electricity and natural gas. And some of these things we did put in to the building, and it was mentioned earlier, the LED. So a lot of the fixtures are LED, not only from the first cost and environmental perspective, but this is the first time that Spectrum has really owned their own facility. So they've always been a tenant, so there's always been someone to call to, hey, this light bulb's out, this bathroom doesn't work, can you come fix this? So I think it's been a little bit of a learning process for the executive team and kind of managing a 36,000 square foot facility and site in the city and kind of making it really continuing the sustainability initiatives. The whole building has a white TPO roof system. The envelope is really high performance. We got about an R20, which is a very high insulation for a commercial office building, and an R38 roof system. And then all of the power is offset by wind power, 35% of it that was purchased. So that was pretty significant for a building like this. And then in terms of managing the energy, one of the, I think the smartest things that Spectrum did in this process was we went through the full building commissioning process, which for those of you who aren't familiar with that, it's really having a third party be the eyes and ears of the owner and looking at once those rooftop units providing your conditioned air into the space, your pumps, your water systems, your lighting and controls, are they all installed as was intended? And usually not. Not to say that, that's not a diss at contractors, but there's a lot going on in the field during construction, and it's something that it really helps to have this third party come in and look at what went in, and is it actually operating the way it should have been. So we not only did the commissioning when the building was up and running, but the commissioning agent also came back just last spring to look at the off-season testing and then also look at all the systems and sit down with Phyllis's team, who's operating the building on a daily basis, and talk through, okay, we've been in here for 10 months, what are the issues? Let's bring the contractor back in while everything's under warranty so that we get the energy efficiency that we intended to get. And I think that was really valuable for Spectrum, being the first time they're owning a building and not leasing it from someone, so that they can really be assured that their energy savings was as we intended in the design process. Because a lot of time went in. We did a lot of modeling, energy modeling. We did a lot of scenarios of different building envelopes, of glazing, and energy was important to them. We're also tracking it, as I mentioned, right now in Portfolio Manager, so we just about have a year of data, and then the idea being that we would continue to track that through the process, as they move forward with the building and bring in more staff, more FTEs, more equipment. That'll change things a little bit. And I think that was it. So thank you. Does anybody have questions? What else can I
can start off with one if you want. You mentioned that you were able to divert the construction waste.
Mhm.
How did you do that? Like, what was the mechanism for?
So what we typically do is we recommend that the contractor, whoever's the general contractor, engages a construction waste management subcontractor that typically now in the market we can get to above 75% with no problem by weight. This is all by weight. So it was the building that you saw in the pictures being torn down that contributed, because that was technically Spectrum owned that. None of the hazardous waste is counted, but the rest of it is, and then all of the construction waste in there. So you set it up as a specification, as a kind of requirement of the contract, that you're going to hit this goal. And there's a lot of teams out there across the country, a lot of organizations that do just that. I mean, there's big ones that everybody knows, Waste Management. I mean, so that's a line of business for them that they will collect. And it used to be that you had multiple dumpsters on a site back when I started doing this. But now typically it's commingled, and then it's taken to a facility and sorted at the facility. And then what you do is you get monthly reports on kind of where you are in the process. So from our perspective, if we see something kind of dropping down, like why are we getting a lower, we kind of go to the contractor and be like, what's going on? Like, did you have something that was hazardous this month that we didn't know about, to try to keep as much out of the landfill as possible. So that's a really good number, the 94% diverted. 95% in the world of LEED is an innovation point for those of you who know LEED. But that was still really good, especially with an existing building to tear down. And that was something that was important to Spectrum from the perspective of just not kind of being a polluter, tearing down that existing building and improving the site overall. That's a good question, though. Yeah.
This is more of a question for Phyllis.
Sure.
But I was wondering how much of this HRSA is aware of, and how much of this you think could be replicated as a standard for new QHC?
That's a good question. We were the first health center in Philadelphia to do this, so we were proud of that. It was not easy, okay, and I think, but HRSA was involved, and as you know, HRSA had a pot of money once upon a time to support the building of health centers, and I hope that at some point this will become. We've had a lot of inquiry, especially in centers that have landfill, that have hazardous waste sites. So us using the brownfield dollars for that was important. There are a number of sites that are looking to see if they can get HUD money to support removal of hazardous waste. It hasn't been something that HRSA has carved out specifically. But I think we're seeing a lot more discussion about it. There are a lot of our funders are interested in looking at supporting health centers, build new facilities. With a program that's 40 plus years old, you can appreciate that there are a lot of health centers who need new facilities and are looking. So this is a way to not only build a new facility, but also to look at the environmental. As Michael indicated, one of the things that we didn't appreciate until we started this was that it really was a catalyst for economic development in our neighborhood. So it wasn't just putting up a building that was going to deliver health care in. We got the community involved in understanding, okay, well, what is green? Because you say LEED and people say, well, what's that? Or you use the term green building, and it's not really a high level of understanding in the neighborhood of what that is and what does it really mean, how does that translate. And I was telling Michael earlier, I was glad to have been in the last presentation because it's clear we have now reached this milestone of getting our building up, but now we need to go to the next step, and that's really rolling out a greater education program internally and with our patients around, okay, what does it mean to be environmentally healthy and improve the quality of life. So I continue to hope that HRSA will see the value of this, but if you know health centers, I don't know if you're from a health center, but you know, we're just barely holding on to, you know, trying to deliver quality care. But it is important, and there are a lot of centers that could probably benefit if they could get additional resources to incorporate that.
And one thing we didn't mention too much is I think Spectrum's done a really good job of like engaging the community in the new center and in the sustainability features of it. So there was a huge open house last summer when it opened and communicated to the residents around. I mean, whether or not they're going to use the services, it was unknown at that point. But I think that, and then just about maybe a month or two ago, we had our lead plaque ceremony, and that was part of a day-long open house where all the community was invited. There were hundreds of people there. So I think that's been communicated a lot to the patient population in the neighborhood, which is great because, and it's also nice to see how respectful I think that the neighborhood has been of the new building and the site around, because there are other very close that things aren't respected as much, and this one is very, it's pristine, it really is, I think, changing that area around it for the better, definitely, and the housing stuff.
Yes.
I'm curious if there are any local or state legal restrictions that are currently in place to prevent the dumping or waste disposal in close proximity to your health center. So in the interest of protecting your patients and based on all of your efforts to remediate, do we know of any mechanisms in place to try to avoid future dumping that could adversely affect your patients?
I'm not aware.
I'm not.
I'm sure through the Pennsylvania DEP, there's probably some mechanism. I think someone was here.
I was going to say, is
She
our
just
environmental
stepped out,
lady
but-
here? Oh, okay.
But in Philadelphia, there's been a big push over the last 10 years to remediate the brownfields because there's so many within Philadelphia County. But I'm not sure about the actual requirements of dumping new waste. No, it's a really good question.
Yeah, it is.
Yeah.
But yes.
I have a quick question about going back to the organic waste that you guys were mentioning is the heaviest waste in your waste management. Did you mention that Spectrum is composting?
Yes.
Is that something, so you guys do, and it's under?
Not at the building.
Oh, not at the
No.
building?
It's the compost material is collected separately
Okay,
and taken to a compost facility.
I see.
There's not like a bin on
Yeah,
the site.
we
that
don't.
goes
No,
in.
yeah, no.
No.
We have the little bin.
We work at Children's National
Okay.
Laboratory, I'm like, we were talking, that would be interesting what that would
Yeah,
look
so
like.
it's
We have
gone-
very basic issues with like,
Right. And this, I think Phyllis was really key on this, was that it was from day one, when you moved into the new facility, like, this was the way it was gonna be. We were gonna do recycling, waste, and composting. So it's like, you moved in, and this was it, and it was just a new paradigm, kind of, so in a new building, this is where your food waste goes, this is where your trash goes, this is where your recycling goes. And it's harder to do if you're already in a,
Yeah.
we
yeah,
found,
did.
at least in our consulting work, it's harder to change that mindset when you're going all brand new site, everything. People got on board and they were like, so it's collected and then it's taken to a compost facility. Yeah, that's a good question though. It's not right on site, like they're not dumping it and mixing it. Yeah, it's compost. Yeah.
I would just add to that there are sites that do a lot of
On site, right? Yeah.
on site and actually get grants from the state to get processing equipment to break down that. So like Providence Health Center, for example, 23% of their waste is food waste.
composted,
And they had a
right.
grant that actually allowed them to get equipment. But I mean, then you have to have the space and you have to have somebody who has the innovation to go after the state grants to do that. I mean, one of the things you can applaud about this project is that was an incredibly innovative funding model to
Yeah.
get to aside from the lead stuff, it takes a lot of know-how to be able to patchwork together.
Yeah, thank you. We had a lot of good, once we engaged the partners, they became invested. They saw that it really was more than just building a building. It really, was going to hopefully begin to help transform a neighborhood that needed not only the services, but was actually stable neighborhood, but in, disrepair just from, housing and what happens in low-income neighborhoods. So we had to overcome things like assessment that didn't reach the requirements for the HUD funding. So, I mean, but they said, okay, fine, we'll figure out a way to do this, so we felt very gratified that, we had a level of support that helped us overcome, barriers that normally would have, prevented us from being able to achieve this.
And it was interesting about the funders that you mentioned was, there were a lot of them, and a few of them actually required to see updates of where we were with our lead path and certification at the end, which is great to see that that's like in the financial world. I mean, it's becoming more and more so, because it wasn't self-funded. I mean, when they were going monthly for updates, we had to show, okay, here's where we are. We have, this is our strategy. These are our strategies on the table. Our design review's done. We're moving into construction, and they wanted to see where that stood as we moved through the whole, from the funding stages all the way through to seeing the certification happen. Was part of some of the requirements on some of the funder sides, which is great to see that.
Yes.
So you mentioned going to the follow back after 10 months to evaluate how the energy systems did. I was curious what came out of that. Like, what were some of the findings? Were you close to what you modeled, or?
Some were and some weren't.
We are just getting like the full year of data to get our kind of Energy Star score right now. There were some issues, I'll say, with some of the rooftop unit equipment that needed to get worked out that I think will have now a more positive impact on our energy usage. That we needed to get the contractor back in, the controls vendor, to adjust some things, let's say nicely.
It was, as Michael indicated, it was the first time Spectrum has owned a piece of property. And there were two things about that we didn't really appreciate until we got there and started trying to live it. We are in a fully, highly technological building. There is nothing about our building that is not technically sophisticated. And that doesn't lend itself to ordinary maintenance. So, just really appreciating our facilities person actually is part of our IT team because they needed to be able to understand how to work the systems. So that was something we had put in for a maintenance person and then realized, oh no, that wasn't going to work. We needed a lot more technical know-how, and really also appreciating that you can build things, but they don't always, turn out in terms of the way they're supposed to work. And a lot of what we found really was related to manufacturing errors, or the system wasn't put in right, or wasn't programmed right, or wasn't, so we spent the last year really trying to work those systems. And as Michael indicated, things were under warranty, so we wanted to be able to be sure that we could get them corrected before we had to take full responsibility for, being sure that they were working overtime. So this past year we've learned a lot more about operating a building than I appreciated that we would need to know. But it really, in the long run, will lend itself over time to, I think, greater efficiencies as we look to carry out delivery of healthcare another 40 years, and then we won't be saddled with, trying to deal with heavy cost for just building maintenance. Yes.
In terms of like the quality check and making sure the systems were working the way you thought they would, I noticed you said you were just getting your yearly data in. Is there a reason you waited a year as opposed to like 6 months?
No, we've been tracking it the whole kind of on a quarterly basis with Spectrum. What we're trying to do is see where our target was in Energy Star is actually, it's not there yet. So I think our June or July 2014 to June 2015 data will be more reflective of the 10% or better efficiency that we're anticipating. I think some, like Phyllis said, the controls kind of needed to get a handle, and not just like the HVAC, but the lighting is actually pretty sophisticated in the whole building. LED, there's dimming, there's a lot of controls for shutting off certain areas that weren't happening, I think is the, and especially because it's open so much. That was all included in the model, but I think some things were going to be on more than they were intended to be on in the controls. And so getting up and running, it was just like they had patients coming in like right away when this building opened. And so the focus was like, okay, we need exam tables. And we're seeing patients like, and going from 11 exams?
We had 14 rooms
to
at 37, so
So that was like
big jump.
the first 6 months, I would say, that was like, we've got to focus on like the healthcare delivery. And then I think in the last 6 to 8, we've really focused with the director of IT and building management and kind of said, okay, and had the commissioning crew come back in, the contractors come back in and kind of remediated that and kind of are digging into like the operations manual for all those systems. But no, we haven't getting the bills every month actually, but then kind of doing a report quarterly. And it's not yet where we really want it to be, but I think it's great that they're doing it because we do a lot of lead projects and then like the data is no one's like tracking it. I mean, it's just like up the, So it's great to see that it's that we're actually looking at how we were anticipating, and if it's not, then we have to figure out what can we do to tweak it to improve the efficiency so they can reduce their costs.
That's great.
Great. Thanks everybody.
So much.
Thank you.